Hello everyone, welcome to sqadia.com. I'm Dr. Hamna Iftikhar and today's lecture regarding gastroenterology is about Crohn's disease. So we've talked about Crohn's disease previously in the previous lecture. We've studied about the causes of Crohn's disease, the incidence of Crohn's disease, and the different clinical features. So in this second lecture of Crohn's disease, we'll be studying about different things. So what exactly is Crohn's disease? Crohn's disease is the inflammation of the intestine, which is available, which can be throughout the alimentary canal, anywhere from the mouth to the anus. It's one of the inflammatory bowel diseases, other being the ulcerative colitis. So this is an outline of the Crohn's disease that we'll be studying today. It consists of differential diagnosis and different types of investigations and treatments. So firstly, we'll be studying about the differential diagnosis. As you know that every disease starts with ruling out the diseases. So this is the differential diagnosis. This is the list of the diseases that we'll be talking about. And then the diagnosis, as you know, every diagnosis must consist of a thorough history taking and thorough examination and then a thorough lab tests. So we'll be talking about the different lab tests that we are doing with Crohn's disease. But ultimately, what is the source of investigation of Crohn's disease is endoscopy. So we'll be studying about these different forms of pictures that we can see through the endoscope in patients with Crohn's disease. Lastly, we'll be talking about the difference between ulcerative colitis and Crohn's disease. Like I've told you, both are in the same category, which is the inflammatory bowel disease. So we will be studying about a lot of differences and how to differentiate one from the other. And then we'll be studying about the measuring disease activity, as it's very necessary to measure the activity of the disease. Is it going high? Is the disease responding to different types of medical therapies or not? So this is very necessary, and there are a lot of different types of scoring system. We'll be studying about that. And then we'll be studying about the different types of medicines that are available for patients with Crohn's disease, different antibiotics, different biological response modifiers. So we'll be talking about that. And then other adjunctive therapies. What are the other symptomatic treatment that we can offer to these patients? These are some medicines, some other therapies. And then we'll be studying about, lastly, the surgical therapy, that different types of surgical therapies that we can offer to these patients, and if they need these therapies, surgical therapies or not. So that's all we'll be studying in this lecture. There are a lot of different lectures on our website, and regarding gastroenterology, regarding cardiology, we have a list of basic medical lectures too, regarding anatomy, physiology, biochemistry. So you can log into our website and subscribe our website. But other than that, if you want to have a free trial, you can start it right away. So that's all from sqadia.com. Thank you for watching sqadia.com.